Dr. Roshini Raj is an internist at NYU's Langone Medical Center. Dr. Raj, thanks for being here.
My pleasure.
So I think this is confusing to a lot of folks. You have prostate cancer is one of the most common types of cancer among men. The guidelines before this had been that screenings were not advised. So what has changed here?
So now the U.S. Preventive Task Force is saying, as opposed to what they said in 2012, where they really recommended against using the PSA test, the blood test as a screen for prostate cancer, they're now saying that men may want to consider having it. Now, they're not saying every man should get it, but have a discussion with their doctor. If they're under 70 years old, between really 50 and 70, have a conversation about whether the screening test is appropriate for them. And the reason they changed is because they found new data that really did support there was a slight increase in survival among men who did get this test done, and more earlier stage cancers as opposed to later stage cancers being diagnosed when you do use this blood test.
Well, just how invasive are these screenings, and what should patients expect afterwards?
So the PSA is a blood test, so it's really not considered very invasive at all.
Okay.
I think that the reason why it was recommended against is the PSA test often did produce either false positives, meaning the test was positive, but the person didn't actually have prostate cancer, once many other more invasive tests were done. Or even if they did turn out to have prostate cancer, many prostate cancers are so slow growing that actually treating it might cause more harm than good. So there's still a lot of controversy over this test and whether it should be done, which is why they didn't come out with a sort of stronger guideline. And it does confuse people, but I think the bottom line is, like many of these screening guidelines, talk to your doctor about your individual risk and what should be done for you.
I mean, so you just sort of answered my question there. I mean, so do you think it'll basically sort of be almost a case-by-case basis here for doctors advising their patients, or will there be sort of a routine process where after a certain age the doctors will recommend that a man get this screening?
Well, interestingly, as you get older, so over 70, most people agree you should not get this test. So it is really for the young, between 50 and 70. And no, I don't think there's going to be one consensus. It will be, as you said, more of an individual case-by-case basis, which really is the way a lot of medicine is heading these days. We're realizing that people do behave differently when it comes to diseases, and these guidelines, while they're sort of important to give overarching advice, don't necessarily apply to the individual person.
All right, let's talk about mammograms. A new letter published by the Journal of the American Medical Association acknowledges there's a divide among doctors about which age recommendations to follow for mammograms. So, a lot of folks are going to look at this and say, what is the takeaway here?
Yeah, I think the takeaway is, once again, there are conflicting recommendations. So the U.S. Preventive Task Force back in 2009 recommended we don't do mammograms until the age of 50. We don't start screening women for breast cancer. Many organizations, including the American College of Obstetrics and Gynecology, recommend starting at age 40. And most doctors, according to this new study that came out, are really going along with the 40 guideline as opposed to the 50, which is recommended by the U.S. Preventive Task Force. So again, too many guidelines out there. There's some confusion. Doctors aren't necessarily listening to some of the guidelines. Talk to your doctor about your personal risk, your risk factors, your family history, and also your personal philosophy about screening and how aggressive you want to be.
All right, just answered all our questions. Dr. Roshini Raj, thank you so much. Really important information.
Thank you.
Appreciate it.